Welcome to my channel Learn. In this video, we are going to discuss the effects of EICOSINOIDS that include prostaglandins and thromboxanes on the different types of organs and smooth muscles in our body. So starting from the effects of EICOSINOIDS that we have discussed, they are the prostaglandins, include the prostaglandins I2, E2, F2 alpha, and different types of leukotrienes that includes the leukotrienes A4, B4, C4. But here we will going to discuss especially the cyclooxygenase pathway metabolites that are prostaglandins I2, E2, F2 alpha, and thromboxane A2. These prostaglandins effect on different type of the organ of our body and on the smooth muscles including uterus, airways, GI tracts, nervous system, platelets, heart, reproductive system. So one by one we are going to discuss this all. The first one is smooth muscle. The prostaglandin I2 and prostaglandin E2 have a vasodilatory effect on the smooth muscles by CAMP pathway, that is cyclic MP pathway, and this pathway work in a relation of vasodilation performed by prostaglandin I2 and E2 in smooth muscle. While the smooth muscles will be constricted in response to the action of thromboxane A2 and prostaglandin F2 alpha. So there will be vasoconstriction in response to these prostaglandins. These are the two opposing effects on these smooth muscles by prostaglandins. Now the next one is on airway. The prostaglandins I2 and E will going to cause the relaxation of the airways, that is a bronchial smooth muscle will going to relax, and there will be opening of the airway because of these two prostaglandins. While the prostaglandin F2 alpha and the prostacyclin D, they both cause the contraction, you can say the bronchospasm, and decreasing the diameter of the bronchi and decreasing the patency of airway. So the important point here arises is that the prostaglandin F2 alpha especially is very sensitive for the asthmatic patients. Why? Because in these patients it will cause the severe bronchoconstriction and this may be fatal. The third organ of the effect is uterus. Prostaglandin E2, for the mnemonic, it will going to cause the relaxation of early uterus. And what is the early uterus? It is a non-pregnant uterus. While prostaglandin I2 will going to cause the contraction of a pregnant uterus. So in both the way, they will going to cause the endometrial contractions to increase, and there will be more and more uterine contractions. While prostaglandin E and prostaglandin F2 alpha release large amount of contractions and uterine contractions during the menstruation and during the labor. So that's why it will going to help both the non-pregnant and the pregnant uterus in labor and menstruation. Now the effect on the gastrointestinal tract, that is the GIT tract. Prostaglandins provide the mucosal protection from necrotic agents, which means that if any tissue is going to damage the GIT wall, the mucosal lining become thickened because of the prostaglandin. So in this way, the prostaglandin prevent the mucosal destruction, and it causes the contraction of smooth muscles of small and large intestine. And oral intake of prostaglandins can cause abdominal pain, cramps, diarrhea, and reflux of bile as its side effect. So these all are the conditions that may be caused by oral intake of prostaglandins in the GIT tract. Some more important points about prostaglandin I2, it causes the mucosal vasodilation, while thromboxane A2 causes the contraction of the longitudinal and circular muscle. In this way, it will going to increase the peristalsis movement of the GIT tract. Now the effects on the GIT secretions. The prostaglandin A2 and I2 inhibit the gastric acid secretions, and the thromboxane A2 also decreases the acidic secretion, but it increases the mucosal secretion. The prostaglandins increase the integrity of the GIT tract wall. How? By helping them in treating the duodenal and the gastric ulcers. We have previously discussed that it will increase the mucosal lining and provide protection against any ulcerative condition in which the mucosa is damaged. So prostaglandins are helpful in maintaining the GIT lining and increasing the GIT motility, that is peristalsis. The prostaglandin E and F2 alpha can also cause the watery movement in the intestinal lumen, thereby causing the watery diarrhea. The effect of these prostaglandins on the heart are as follows. The prostaglandin A2 and F2 can be weak inotropic effect, and they also going to increase the cardiac output. In platelets, there are two opposing effects of the prostaglandin that prevent the clotting of the platelets. The prostaglandin G2 and the prostaglandin I2 will going to inhibit the platelet aggression and activation to prevent the clot formation. While thromboxane A2 can cause the platelet aggression, in any case of injury there will be a clot formation. But because of both the balancing condition, there will be no extravascular clots and no excessive clot will be formed in the blood vessel. Effect on the reproductive system include on the two, female and the male reproductive system. The first one on the female reproductive system is important. Why? Because the prostaglandin E2 and F2 alpha act as an abortifacient. Means it can cause the abortion in 80% of cases. How? By increasing the uterine contraction. We have just previously discussed how they increase the uterine contractions. The early uterus and the pregnant uterus, there will be increased contraction. So that's why, because of excessive increased contraction, there will be abortion. In the male reproductive system, these prostaglandins, mostly the prostaglandin E1, that is pharmacologically called alprostadil, is used in the treatment of erectile dysfunction in impotent men. So there it may be helpful and it may provide therapeutic effect. So guys, this was all about the effects of eicosanoids and prostaglandins on platelet, heart, GIT, uterus and smooth muscle and airways. So I hope you will explain well. Thank you for watching. Subscribe for more and don't forget to like, share, subscribe, give feedback on our Facebook page. If you want more videos on different topics, you can also give feedback on our Facebook page. Like, share and subscribe our channel. Thank you for watching.